arthritis usually affects the elderly, juvenile rheumatoid arthritis, also known as JRA, can afflict children. More than 300,000 children in the United States are diagnosed with this condition.
Arthritis is actually one of the most common chronic childhood diseases. By chronic, I mean that it's not something that you get and then it goes away. It's something that you get and it stays with you. It may go underground for a while, but it's still there. And it's actually probably more common than juvenile diabetes and then some of the others. In fact, I've heard estimates that it's more common than all the other common ones put together.
But what exactly is it? Rheumatoid arthritis is an autoimmune disorder, meaning a disease in which your immune system attacks normal body tissue and cells. In the case of arthritis, antibodies are created to attack joints that the immune system mistakes for foreign substances. Your body treats the joints as an infection and attempts to dispel it from your body. Children living with arthritis suffer from swelling and stiffening joints, fever, rashes, severe pain, and eye inflammation, as well as the long-term effects of bone deformities and antibiotic resistance. Rheumatoid arthritis can be classified in 3 different ways: pauciarticular, polyarticular, and systemic. Pauciarticular affects 4 or less joints. This is the most common form of JRA and accounts for 50% of cases. Children with this type of RA are more likely to have arthritis in their larger joints. Polyarticular affects more than 4 joints and accounts for 30% of cases. The joints affected are mostly symmetrical. This means that if a person has arthritis in their left elbow, they have it in their right elbow as well. The least common form of rheumatoid arthritis is systemic JRA. Systemic JRA afflicts only 20% of all JRA patients. This type is also known as Still's disease and strikes with bouts of body-wide illness, including fever, rashes, and swollen lymph nodes. A lymph node is a sac where your body stores liquid. They are located throughout your body and when swollen can indicate infection. Some symptoms such as uveitis are common between all types of JRA. Uveitis is an inflammation of the eye, more specifically the uvea. Think of an eye like an egg with 3 layers. The shell is the outer part of the eye, the egg white is the middle, and the yolk is the inside of the eye. The egg white would be the choroid layer, the yolk would be the retina, and the shell would be the white of the eye. Uveitis affects the choroid layer at the back of the eye and often involves the retina. The choroid layer contains blood vessels and connective tissues. The blood vessels supply many vital nutrients to the inner eye. The retina senses light and creates electrical impulses that are sent to the brain. When a person contracts uveitis, they are susceptible to glaucoma and vision impairment. It can be triggered by autoimmune disorders, but is not unique to those with autoimmune diseases, and healthy people can also contract uveitis. Not all people with JRA conceive uveitis, but when they do, it is one of the more serious side effects. Although arthritis is incurable, kids with JRA experience varying degrees of symptoms from day to day. Remission is a period in which symptoms become less prominent. In polyarticular and pauciarticular JRA, this means decreased amounts of pain and inflammation in arthritic joints. In the case of systemic JRA, remission means less sign of illness. During flares, symptoms intensify. There is no known cause for flares, but researchers believe that flares may be triggered by sickness. When a person becomes sick, their body fights off the new sickness and makes the immune system more active. Because JRA is an autoimmune disorder, the immune system works harder and attacks joints more viciously. Also, flares can be related to extreme stress, similar to how people can contract colds more easily when they're under stress. The group most heavily affected by juvenile rheumatoid arthritis is Caucasian girls. Researchers are not sure of why this group is more susceptible to JRA, but hypothesize that this may in part be due to the fact that JRA can be hereditary. Although the causes of JRA are still unknown, researchers are working towards finding the triggers in an attempt to discover a permanent cure. So far, researchers have discovered a connection between JRA and environmental factors. In addition, hereditary links have also been found. For example, the offspring of people with a rare blood cancer called Waldenstrom's macroglobulinemia, also called Waldenstrom's, are at greater risk to develop autoimmune diseases. While arthritis does limit daily activity, it does not prevent people with JRA from living a full life. Kids with RA can participate in sports. Depending on the intensity of symptoms, different modifications can be necessary to ensure a pain-free experience. This can range from wheelchair sports to wearing a brace or constant substitution. Often people with RA turn to sedentary activities such as swimming in heated pools, which soothes their joints. JRA patients have limitations but are still able to participate in sports.